Welcome to our root cause thyroid webinar. I'm Dr. Jeremy Lamb. Let's take a dive into really what's going on with the thyroid. So, first, to start off, the shocking statistics about thyroid and hypothyroidism is about 7% of the US population. About 23 million people actually take thyroid medication, which is levothyroxine. It's the second most prescribed prescription in the US. And of those still taking levothyroxine, 70% of patients still complain of symptoms. Now, this webinar is really for those who just feel ignored by their doctors. When you tell them that your labs are normal and they tell you that nothing is wrong with you. If you're really frustrated with needing to keep going up on your dosage of thyroid medication and yet you're still tired, maybe if you're wondering if there's alternatives to medication to levothyroxine, and ultimately, also, if you're trying every diet, trying to exercise, trying to lose weight, and you still can't budge on the scale. And so, who am I? I am used to practice conventional medicine, and I was really ordering just TSA, T4, and giving Synthroid for my patients with hypothyroidism. And I kept seeing patients come back and really not seeing improvements. And I felt like I couldn't give patients answers for really why was their thyroid slowing down? What was really the root cause? So I decided to actually further my education in functional, regenerative, anti-aging medicine. I spent over 4 years, over $50,000 in this education. So ultimately, that you and patients don't have to guess and try and do things that way. I am personally affected by this as well because this was actually my father-in-law's labs where his TSH was high. It kept going up. And ultimately, his doctor kept wanting to put him on levothyroxine. And I said, no, there is another way to naturally reverse thyroidism, hypothyroidism, and actually feel better. He was feeling fatigued. He was having sleep issues. He was having joint aches as well. And so I put him on a program, and this TSH actually came down very nicely with the key without needing to be on medications and addressing the root cause. And so ultimately, my sister, Dr. Carey, and I opened Lamb Clinic because we're really able to run more extensive testing and get down to the root cause. Patients are able to decrease their thyroid medication dose and ultimately, again, have more energy and lose weight again because we are able to address the underlying problem that way. So our mission really is to make integrative and functional medicine really what it should be. You should be able to go to your provider who has time to really understand nutrition, lifestyle, supplements, and really get down to the root cause and hopefully give you hope that there is ways out of this disease. Okay. And oftentimes in medical school, I only spent probably about 2 hours in about 7 years of education actually understanding nutrition. Yet a huge part of what we do is whatever we put in our body is what comes out. And so ultimately, me and Dr. Carey were very limited. We had a long waiting list, and that's why we've expanded our team. And we have a lot of amazing nurse practitioners and PAs, and we've helped over 10,000 patients really get to their root cause. But I'm ultimately doing this webinar because I have a passion for ultimately reaching a wider audience and letting patients know that there is other answers out there and that you don't really have to do it alone. So let's first hear from Elaine. Elaine has been taking thyroid replacement for 30 years, and after seeing us, she finally found out that she had more energy.
Wow, I feel extremely better, so much better. Even during the day, I now can go on with my day. And at the end of the day, I'm like, wow, where did I get all that energy? I really have forgotten about the fatigue. That's how much better I am feeling. My hair has stopped shedding. I am sleeping better, still working on that. But the fatigue, which was really, really serious, it can even emotionally set you back, the fatigue. Um, it's so much better. My energy level is, I'm even more joyful because of it.
Yeah. And I understand that even your family members are also seeing a difference in how you are now. So, how many of us can really relate still to Elaine and wanting better sleep, wanting more energy, right? And ultimately, again, just having your mood feel better that way. And so ultimately, if you've been struggling This might be why. Maybe because you're only checking certain labs and not really getting to optimal ranges. Maybe you're only taking levothyroxine and not any other nutrients. Maybe because your reproductive hormones are imbalanced and your adrenals are stressed, but you're only blaming the thyroid. And maybe you're also not checking for toxins, or maybe like your gut is also imbalanced. So let's dive into the three secrets of the root cause thyroid method. The first secret is the optimal thyroid labs and reference ranges. So we have to go beyond what the standard labs are telling us. Okay. Secret number two is why your thyroid is just one piece of actually this whole puzzle that we're trying to address. Hormones, stress, nutrients, toxins, gut health. It could also lead to also thyroid issues. And secret number three is natural ways to heal the thyroid without relying on medications. So let's dive into the first secret, where we want to go beyond the standard lab ranges and actually find what optimal levels should be. So let's talk about actually a patient who came to see us first. Her name was Sarah. She's a 52-year-old female. She had fatigue, hot flashes. She had problems sleeping and difficulty losing weight. She was on levothyroxine and she kept going to see her Kaiser doctor, and they just kept checking her TSH, and they kept telling her that things were within range. However, she was feeling more anxious and really didn't feel like herself. Her doctor said, "Hey, this is just part of aging. I can get you an antidepressant," but she really didn't want to take it. And that's where she decided to find an alternative and ultimately come look for us. And so we wanted to order a full panel for her. So we actually wanted to find out first her antibodies related to her thyroid. The second thing is we also wanted to test not only her TSH, but her free thyroid hormone levels, specifically T4 and T3. Okay, so most of the time, TSH is actually what stems from the brain. It goes to our thyroid right here. And then your thyroid is what actually produces T4, which is actually levothyroxine. Okay, now interestingly, T4 needs to get converted to T3 in the extracellular part of your body. And the peripheral part of your body, T3 is actually what is the active hormone. So T4, remember, even though it's levothyroxine, needs to get turned into T3, and T3 is what gives you energy, is what affects your metabolism, and what also affects cellular function. So some patients actually can be put on T3 medication because they actually feel better with that. Maybe you're actually not converting from T4 to T3. So no matter how much levothyroxine you're actually taking, you might actually still not be having the active thyroid hormone. And so that might be an issue. Also testing an antibody to see if your body's attacking your own thyroid, right? Or Hashimoto's and an autoimmune thyroid disorder, and if we can actually hopefully decrease the antibody dosage so then your body stops attacking your own thyroid. And that would be the ultimate goal. So on the left side here, we have traditional reference ranges, and on the right side, we have optimal, right? If you go to Quest or LabCorp or any big company, standard lab ranges, which is on the left side, is based on population averages and not really optimal. So we can see in actually the past 10 and 20 years that the TSH upper limit has been keep on going up. So it used to be actually 3, 4, now it's actually 4.5. And so more and more people are getting diagnosed with hypothyroidism because ultimately you're comparing yourself to the general population, right? That bell curve. But you're not really finding optimal ranges. Okay, so we, for example, look at TSH. I actually strive for a TSH of 2 and under. So you might be on levothyroxine 75 micrograms and your TSH is 4, and your doctor says, okay, your labs are fine. I'll see you in 6 months. But again, we want to take it to an individualized approach to where your body feels the best. Testing for free T3 and free T4 is also really important, and there's optimal ranges for that. And obviously, we don't want our antibodies to be present at all. So again, there's a difference between uh, normal ranges and then optimal health, and we want to take an individualized, personalized approach to everyone's body that way. There's actually more and more studies that are coming out that increase TSH. So if your TSH is greater than 2.5, you are at increased risk of metabolic syndrome, of actually cardiovascular disease as well. And so this study showed actually that TSH should be less than 2.5. Yet again, Quest, LabCorp, we want to fall within that big bell curve. So again, you want optimal ranges that way. Some other controversies again is that uh, TSH is still only one marker, right? We don't want to only use TSH to tell us what's going on with the thyroid. You want to be able to see your free T3 and your free T4 levels as well. So, for example, in Sarah's case, her TSH was actually 4.3. And so her Kaiser doctor kept saying, hey, just continue your same dose. We'll give you the antidepressant because you're in the normal range. Her free T4 was fine. And we actually looked at her free T3 and she was not converting her thyroid well, even though she was on the medication. No wonder she was feeling tired. No wonder she wasn't able to lose weight because her thyroid, the active thyroid hormone, was not actually converting to the metabolic active hormone that way. And so again, her antibodies were also positive. So, who really needs expensive thyroid testing is really not that much labs. But if you're really on any thyroid medication, if you've been told you have any autoimmune or Hashimoto's, if you have the fatigue, the hair loss, the gut issues, if you're unable to lose weight, then you really need to dive deeper into figuring out what else could be going on with the thyroid. So remember, secret number one, to summarize, is make sure you're getting the right testing, and if you do get the right testing, make sure you are striving for optimal thyroid lab ranges and go beyond just the normal standard lab ranges.